Yum, yum.
For every dance party, snack time, and baby breakdown, mom of two Gladys Qualls is the anchor for her little ones. But she hasn't always felt supported.
The depression started to set in when the dishes started to pile up, when the clothes was not being washed, where I realized, I wasn't feeding myself.
During her second pregnancy, she felt unheard in the delivery room. And that isolation continued when she couldn't find resources for single mothers.
Like a tug of war, like you pulling and fighting where it shouldn't really be.
But she says she's grateful for programs like Baltimore Healthy Start that offer wraparound services for mothers in a country that has the highest maternal death rate among developed nations.
I know a lot of other mothers not wanting to go to hospitals because they just know how quick that power can be taken from them.
The Enhancing Maternal Health Initiative launched at the beginning of the year to reduce maternal health disparities. And Maryland has found itself at the center for the driving change.
What we funded was a collaborative of minority-serving institutions with a focus on historically Black colleges.
It's all part of a 5-year, $50 million investment across 16 institutions. Morgan State was selected to be the center of all the research that will then go and be implemented on a larger scale.
This problem didn't start yesterday. There are grassroots leaders all over this country and all across Maryland, but what they needed was the kind of commitment and resource.
Carol Johnson, administrator for the Health Resources and Services Administration, joined local health organizations, government officials, and patients at Morgan State to discuss maternal health. And at the table is Gladys.
They don't listen to moms. They don't listen until it's too late, and then it's like they judge. They judge so much. It's like what they say, damn if you do, damn if you don't. Like, it's like you don't win.
Black women and Indigenous women die at 2 to 3 times the rate of white women. We got to get people in prenatal care earlier. We got to help make sure that they can get there. If you need to take time off work and get childcare for your kids and take a couple of buses to get you to your prenatal visit, that's a very hard thing to do.
Studies show 80% of maternal deaths are preventable. Johnson says they offer a maternal mental health hotline, train community-based doulas, and provide home visits to connect moms with nurses and social workers.
The president really fought to double the federal investment in it. So when we started, Maryland got about $7.5 million a year in this program. This year, Maryland will be eligible for $9.8 million, and we're going to continue to grow it every year for the next 5 years.
Another effort has been diversifying the delivery room.
We have a number of OBs, midwives, and others who practice there because we helped recruit them there with our scholarship and loan repayment programs.
I just want change to start happening and, the equality to start being pushed all around the board. And it starts with us.
Tara Burnett, WMAR 2 News.
Did you enjoy that story? If so, don't miss out on other great content posted daily. Subscribe to us by clicking on that circle and start watching the latest news and weather right here on YouTube.